everyone, welcome to Back in Motion Chiropractic and Rehabilitation in San Diego. My name is Dr. Sean Golden.
And I'm Dr. Tyler Forbes.
And I know if you clicked on this video, you probably have some type of pain, whether it's acute or chronic. It might have been going on for some time, you might be frustrated about it, you're definitely looking for answers. So in this video, what we want to do is explain to you who we are, what we do, why we're different, and how that can help you get out of pain.
Cool, thanks. Listen guys, the truth is you have a few options. When you have an injury, the first place you usually go will be your medical doctor. And please keep in mind, I love medical doctors. The world without medicine would be a terrible place. But their repertoire is so large that oftentimes it doesn't really include active protocols for neuromusculoskeletal conditions. And typically the treatment plan will be one that involves anti-inflammatory medication or pain medication.
And those can be great for an acute condition or an acute injury, but it doesn't really do anything to solve the problem, and they don't usually help chronic conditions.
Yeah. And the second spectrum, or the second modality that's often you're referred to, would be physical therapy. And again, another profession that I really, really respect and admire. Their focus typically will be one on rehabilitation and strengthening, because that's what they were taught. And that's understandable, because they believe that if there's an injury, then if you strengthen and stabilize it, the injury will get better.
And strengthening and stabilization is definitely an integral part of a rehabilitation program, but a lot of the times what we now know is that it shouldn't be the first step. We now realize that people are so sedentary and they're sitting all day that their muscles, they tighten up and get shortened, and that restricts their motion and leads to more inflammation and pain. And a lot of the times that needs to be addressed first before the strengthening and the stabilization.
And to prove that out, you guys, I want you to think about a car ride or a long plane ride. You've been sitting for 12 hours straight. If the idea of sitting makes you feel like your muscles are going to relax, then when you popped up off that 12-hour flight, you should be like ready to go, but you don't. In fact, you can look around, and I don't care how old you are, you see evolution of man happening around you, right? You get up off that chair and you're like, oh. It's pretty horrible. So what we now know through science is that immobility actually leads to a restriction in motion within the muscles that puts more pressure on the tendon, therefore more pressure on the joint, leading to the inflammation, and that's usually one of the primary drivers in a lot of pain.
So early on as chiropractors, we realized the limitations that came along with traditional chiropractic. When you hear chiropractor, you usually associate that with neck pain or back pain, and exclusively being specialists with the joints. But we realized in the beginning that wasn't enough. That would maybe only get 70% of the patients to feel better, and sometimes the pain would come back. So we needed to we couldn't be so myopically focused on the joints. We need to branch out farther than that.
Yeah, and so what we focused in on initially is actually loosening the muscles, really intensively loosening the muscles, breaking the muscles up to allow that joint to function properly. And as it started to work in the areas that we were traditionally trained, that being the areas that you guys associate chiropractic with normally, would be the neck and the lower back. As we started to work on that, we started to obviously now start to play with other things. And the person that came in with chronic rotator cuff tendonitis, we started using the same sort of practices, breaking the muscles down around that area to allow the joint to move properly. And so it really led to an evolution of not just our practice and our focus, but this expansiveness in terms of the types of treatments that we actually are focusing in on. And so now, as chiropractors, I can sit here and tell you that our practice right now, yes, of course, we see neck and lower back patients, for sure, as every other chiropractor does, but now we focus in, or we specialize in things you never normally associate with chiropractic. Things like rotator cuff tendonitis, things like patellar tendonitis, Achilles tendonitis, plantar fasciitis, shin splints, you name it, we treat it. And the truth is that all of these problems are really, really easy to solve if you actually really look at the causation.
Once you understand the anatomy and really what's going on with the tissues, all of a sudden the treatment becomes a lot clearer and a lot easier to understand. So what we're trying to do here is we're actually trying to spearhead this movement. We believe that how we're practicing is really kind of the next step for all chiropractors. So we want to lead this movement to kind of progress the field, not only to where we think it can be, to where we know it should be.
And to be honest with you, our biggest goal, you guys, is to get you guys feeling better. Because if you stop doing the very things that you love, if you stop running because you have hip pain or knee pain or shin splints or plantar fasciitis, you're taking stuff off the table. And if you take those things off the table, then you're facilitating this aging process. So you can't change your age, but you can change the way you feel. And part of the way you feel, not just physically, but also emotionally, is really a byproduct of all the things doing all the things you love to do. And so what our objective is, our goal, is to not just educate you on what's going on, but really figure out what's causing it, and then give you these really active solutions, because we really want you guys to understand the idea that we're not doctors. We're facilitators. See, you guys are the doctors. What you do outside the office is going to get you better. And we want to put you on the right flight path. You are not a victim, okay? You are in control of what it is that happens to you.
So beneath us, you're going to see a bunch of different content videos about a plethora of conditions. Feel free to go search around for whatever you're going through to see if we have it up there. We're constantly adding more and more as the weeks go on. I really hope that this serves you. We're trying to put as much out there to get you as well as you can be, to get you feeling as good as you can. I hope this serves you. I hope you get benefit from this. If you ever have any questions, feel free to reach out to us. And I hope you have a good one.
See you guys.